Hello everyone, I'm PT Jason, and thank you for stopping by the Virtual PT Institute. This channel is my brainwave to take quality physical therapy under expert guidance directly to you so that you can get yourself feeling better anytime and anywhere. It's my hope to discuss many different problems and different ailments and their treatments on this channel, and maybe I can even incorporate a few special guests here or there because I really am a believer that based on the movement research and evidence that's out there, that movement and exercise is the key to reducing these mechanical pain problems. To begin, we're going to dive into a topic that ails nearly everybody at some point in time, and that is low back pain. It's the ultimate nemesis of our normal function. It's like the pinnacle of orthopedic healthcare expense. And when you experience low back pain, you often feel dread, you might feel anxiety, you might feel fear. You immediately go to those places in your thoughts, those negative places. And I'm here to tell you that you don't need to go there. Back pain can and does resolve. Now, it is very multifactorial, and what I mean by that is that there are many components of that. There's physical components, there's anatomical components, physiological components, emotional components, but there are two super easy things that you can start doing right now to begin your back pain healing journey. What are those two easy things? Super simple. First one, you need to stand and you need to sit with a posture that would make your grandmother proud, right? We all need to have better sitting and standing posture. When we're up in good posture, the force through our spine is more evenly distributed, and it helps tissues that may be irritated begin to heal, and it helps prevent injury in the future. One of the back pain gurus of our time, his name is Robin McKenzie, and he was asked one time in a conference by somebody, he said, "Hey, Robin, if there's only one thing that you could fix for a patient on their treatment evaluation session, what would that one thing be?" And he looked at that person and said, "If I could only fix one thing during that evaluation and one treatment, I would fix their posture. It's really important." And so I'm going to go over that real quick and show you the really simple but effective way to sit and stand with good posture. All right, now when it comes to your sitting posture, like I said, super easy thing, our sitting and standing posture to fix to help with our low back pain. Really crucial, and I tell my patients all the time this really quick phrase to help you, all right? To help sit up tall, what you want to think about is keeping your ear, your shoulder, and your hip in a line. Right, so ear, shoulder, hip in a line keeps your spine nice and fine. That's what I like to say. All right, so when you sit up, you want your ear, your shoulder, and your hip in a line. You want your feet flat on the ground, which means you might have to move your bottom towards the edge of the chair or wherever you're sitting, okay? But this is a great position for your spine. It helps distribute those forces more evenly through your spine to help irritated tissue that might be painful. And it's a really healthy position. Most of the time we're all like this, right? We get on our phones, we're on our computers, and we sit forward like this. That's not good for us, right? We need to sit up nice and tall, roll that hip forward, and remember, keep your ear, your shoulder, and your hip in a good line. That way you can type on your computer in a good position, you can look at your phone up tall in a good position, and keep your spine healthy. That's really crucial. So we figured out good sitting posture. We're gonna take that same principle for when we're standing or when we're walking, and we're gonna apply that in that new position. But like I said, same thing, ear, shoulder, hip in a line. You're gonna stay up nice and tall. That's a good position. One simple thing to help maintain that position is just putting your hands behind you like this. All right, I call it the stately stand or the stately walk. When we do that, it pulls our shoulders back a little bit, helps your spine get in a good position so that when we're walking or we're standing, we keep those forces even through the spine and can help decrease the pain of the back and the irritated tissue through there. So again, crucial for our sitting and standing posture. That's the number one thing we can start to fix to help with our low back pain. All right, now we're all sitting up tall. We all have better posture. It's really good for our spine. We spend so much time bent over our phones, bent over our technology, and we need to get stretched out of that position by sitting up tall and standing up tall and looking at the world around us. The second big key thing when you're dealing with back pain is get outside and go for a walk. Even if you're sore, this is really crucial. There is so much evidence, there's so much research, and it's been proven over and over and over again that it is beneficial to get out and walk, especially when you're dealing and managing with your low back pain. It's been shown to decrease that as you work on that walking program. Why? Because we're made to move. And so it's good to get outside, get some fresh air, walk, recognize that walking is not harmful to any of the tissues in your spine, even if it is a little bit sore. But again, something simple that you can start doing right now today to start your back feeling better. With these two fundamental fixes, we learn that sometimes it really is the simple things that are often the most effective. And I can tell you from my own experience as a physical therapist in my clinic, that the patients who keep moving and start to incorporate these two things into their daily life fare much better than those who begin to isolate themselves and become more sedentary. For more helpful tips and exercises to help you understand and take control of your back pain, I encourage you to go check out my course, Take Back Your Back. You can also subscribe to this channel for more content that's going to be coming related to low back pain and future content related to other mechanical and orthopedic pain problems. Because there's a host of different ailments that we deal with. And again, I'm a believer that exercise and movement can really help that out. So again, thank you for stopping by, and I hope you found this helpful.